Hello, my name is Ainsley Bryce, and I'm the Executive Director of Holler Harm Reduction, a nonprofit syringe service and overdose prevention program based in Madison County, North Carolina. We work with people who use drugs in rural Western North Carolina by providing safe using supplies, overdose prevention education, and naloxone. Our organization focuses on direct services to promote health, community, and advocacy for people who use drugs, while ensuring that the voices of drug users are centered in our work. Based on our commitment to meeting folks where they are, we have an intimate view of the needs within the community, especially concerning overdose rates and the presence of fentanyl in the illicit drug supply. In this video, we will talk about fentanyl test strips, which are a tool for pharmacists in the fight against opioid overdose. North Carolina has experienced a steady increase in fatal overdoses over the past several years, and this was exacerbated by the COVID-19 pandemic. In 2022, the North Carolina Department of Health and Human Services announced that on average in 2020, 9 North Carolinians died per day from fatal overdoses. This was a 40% increase from the year before. The increase in overdose deaths can be directly linked to the growing presence of fentanyl in the illicit drug supply. Fentanyl, a synthetic opioid initially developed by pharmaceutical companies for pain management, and its analogs have been appearing as an additive to illicit heroin in North Carolina since 2015. Over time, fentanyl has replaced the heroin supply in North Carolina, resulting in individuals with opioid use disorder receiving a substance that is 50 times stronger than traditional heroin and 100 times stronger than morphine. In 2020, more than 70% of overdose deaths in the state likely involved illicitly manufactured fentanyl, often in combination with other substances. More than 60% of overdose deaths involve multiple substances, and the involvement of stimulants like cocaine and methamphetamine is increasing. Fentanyl test strips were originally developed to screen for the presence of fentanyl in urine in 2011 by BTNX. BTNX fentanyl test strips qualitatively detect the presence or absence of fentanyl and fentanyl analogs in urine, but do not assess for concentration levels. Based on a recent report on the efficacy of fentanyl test strips, we know that they provide the highest sensitivity and specificity for fentanyl and its analogs. This means that when used on an illicit drug sample, BTNX fentanyl test strips can detect all fentanyl analogs 90 to 100% of the time with the smallest needed sample. These findings suggest that BTNX fentanyl test strips technology is effective and can be used off-label to detect the presence of fentanyl and several fentanyl analogs in street drug products. Fentanyl test strips have since been adopted by syringe service programs nationwide to test illicit drug solutions for the presence of fentanyl and provide the agency to drug users to easily test their supply on their own. As harm reduction programs begin including fentanyl test strips in their overdose prevention services, we needed to change the ways in which participants were counseled in order to get clear results when testing their substances. Programs now educate participants on collecting a small sample of the drug in question, either residue from a used baggie or a cooker, a small amount of powder, or a piece of a crushed pill, and mixing it with water to dilute the substance before dipping the end of the test strip into the solution. Strips will then produce a single red line for a positive result or 2 red lines for a negative result. These instructions vary greatly depending on the substance being tested. For example, methamphetamine needs a greater dilution in order to provide an accurate result. Less than 1 milligram of powder to be mixed with 4 ounces of water, while cocaine, pills, and non-injectables need 6 milligrams of powder mixed with 1 ounce of water. While we commonly think of heroin being laced with fentanyl, drug users can also be exposed through a variety of other drugs. Fentanyl is now found commonly in non-opioids like methamphetamine, cocaine, MDMA, illicitly pressed pills, and ketamine. Pharmacists are by and large the most accessible medical professionals in our communities, and as drug experts are responsible for understanding and educating patients on the risk for overdose associated with all illicit substances. As noted, individuals who use stimulants, pills, MDMA, or ketamine recreationally are at a higher risk for fatal overdose because they may be unaware for the potential for fentanyl contamination. For example, a person who uses cocaine sporadically would not have built up a tolerance to opioids, and if exposed to fentanyl-contaminated cocaine, could experience respiratory depression and arrest, potentially leading to a fatal overdose if not treated properly. Recent studies on fentanyl test strip use among drug users has found that when given access to testing technology, individuals are more likely to change their drug use behavior in order to increase safety and prevent overdoses. A 2017 study interviewed 125 individuals who use drugs in Greensboro, North Carolina. Study participants who used fentanyl test strips prior to use and received a positive result were 5 times more likely to incorporate safe practices in order to minimize overdose risk. Many reported reduced drug use and use of other practices, including using a tester shot, having naloxone on hand, and utilizing the buddy system to reduce chance of fatal overdose. This is further evidence that people who use drugs when receiving test results indicating potential harm can change how they inject drugs to prevent adverse health outcomes. Despite the efficacy and necessity of fentanyl test strips, there are still barriers to access, and there are many misconceptions regarding the legality surrounding fentanyl test strips. According to the Drug Paraphernalia Act, knowingly testing and analyzing illicit substances are unlawful. But in 2019, Governor Cooper signed the Opioid Epidemic Resource Act, which legalized fentanyl test strips. While fentanyl test strips are legal in North Carolina and have been since 2019, paraphernalia laws continue to add confusion surrounding what is allowed and what isn't. Fentanyl test strips are currently legal in only 22 states. While fentanyl test strips have been legal in North Carolina for 3 years, there continue to be issues with accessibility. Syringe service programs are typically the only organizations that carry test strips and, due to demand, will often run out. Utilization and demand have gone beyond just opioid users due to fear of overdose with a contaminated supply. With the increased presence of fentanyl in methamphetamine, cocaine, MDMA, pressed pills, and ketamine, we continually receive requests for test strips and naloxone, so those who traditionally don't use opioids are able to safely use the substances of their choice without the risk of fatal overdose. Due to many complicating factors, including stigma, some drug users are apprehensive about using a syringe service program for needed supplies. These folks may not inject or need syringes, but they would utilize items like Narcan and fentanyl test strips. As trusted community resources on medical information, pharmacists have the ability to connect with individuals and provide life-saving information in collaboration with harm reduction groups. By increasing the availability of fentanyl test strips, especially in a pharmacy setting, individuals will be more likely to receive overdose prevention education, including safe using practices. At this time in the overdose epidemic, it is necessary for community stakeholders to work together to improve health outcomes for our patients. Pharmacists have always been saving lives. This is what the profession is about, and fentanyl test strips are another way of doing it. I hope you found this video helpful in understanding the benefits of fentanyl test strips and the need for increased availability. For more information on fentanyl and how you can connect with local syringe service programs, please check out the North Carolina Association of Pharmacists Harm Reduction Toolkit at www.ncpharmacists.org. Thank you.